everybody. Welcome to Medicine and Science on the Pod TV network. And today we have a very exciting topic to discuss. It deals with a big problem in the United States of America and around the world. It's called dementia. Now, we have 10,000 people a day turn age 65 in the United States. As the United States gets older, they also suffer from dementia. And it's become a big, big problem. But it looks like there's a vaccine that may reduce dementia about 20%. And oddly enough, it's the shingles vaccine. But I'm not an expert. I'm not like Jay, who's an RFK, who's an attorney that pretends to know about medical science, which he does not. Instead, we're going to turn this over to a real medical doctor, a person who's board certified in internal medicine, to give us a background on this shingles vaccine and dementia, which affects a lot of people in the United States and, of course, around the world. So none other than Dr. Michael Patmos. This is a very hot topic dealing with dementia and the shingles vaccine. So what can we learn from this?
Well, good morning, Nick. Good morning to all the viewers. Happy to be with you again. This is a very interesting topic because, as you said, dementia is a major problem around the world, and especially in the United States with our aging population. There is a thing in the United States called the silver tsunami of people aging into their 60s, 70s, 80s, and 90s, and the burden of dementia, particularly Alzheimer's disease, in this group is really significant. It's a big burden on caregivers and family members. It's expensive, and the insurance coverage, Medicare doesn't cover a lot of services for people with dementia. So it's a big problem, and anything that we can do to reduce the risk of dementia is really something that's of great interest. Now, a paper was just published a couple of weeks ago that got a lot of attention in the media. It was published in Nature magazine, and it is a retrospective review, but a unique one in its design, that showed there was an association between shingles vaccination and a reduction in subsequent dementia to the tune of about 45%. It was really strong as far as the amount of reduction. But remember, this is a retrospective review, so it cannot, by design, prove causation. It can only show association. But this is not the first study to show an association. We've had multiple studies, all retrospective reviews, dating back to 2022, that show an association between shingles vaccination and reduced dementia. What made this most recent study so exciting, and the reason why it got into the news, is because of its unique design. This study was conducted based in Wales. And in Wales, they did a very interesting thing. Anybody born before September 1st, 1933 was not eligible for the shingles vaccination. They could not get it under the law in Wales. And everybody born after that day was eligible. And there was a lot of people in Wales who got vaccinated for shingles. And if you look at the data, and what was in this paper was really exciting, was that the people born who didn't get the vaccine, born before September 1, 1933, had a high incidence of dementia with age, and the people born after that who got vaccinated did not. So that arbitrary date of September 1, 1933 kind of created like two groups, a control group and an experimental group. Now, the problem is that, of course, it's retrospective, and it's also subject to a number of kinds of different built-in biases, including healthy person bias, selection bias, and so forth. So, but it is very interesting. And the thing that makes it so interesting is that it's not the first study to show this. It's just it's the best designed study we have yet, though it is not prospective. Now, there's another point to be made, and that is that this makes very good biological sense. There's a plausible mechanism of action here. Why? Here's why. Herpes zoster, a virus that causes shingles, is a neurotropic virus, meaning it's a virus that gets into your nervous system. There are other neurotropic viruses. We have lots of models of neurotropic viruses that get into the nervous system that produce long-term neurological injury. Polio, let's remember polio. Rabies, it gets into the nervous system. Measles with subacute sclerosing panencephalitis. HIV causes HIV dementia. COVID, and even influenza. And there are more. These are all examples of viruses that enter into the central nervous system. Now, what is herpes zoster? Herpes zoster is a term that we use. It's applied to the virus varicella zoster. Varicella zoster is the chickenpox virus. It's a virus that is ubiquitous, and prior to the immunization with varicella vaccines that are offered to children, chickenpox is ubiquitous. Everybody gets it. And when you get chickenpox as a child, that virus stays in your central nervous system forever. The virus stays in the dorsal root ganglia of the spinal nerves where it persists. And then for reasons that nobody understands, thought to be due to just senescence of the immune system, that virus reactivates and it comes down along the path of a single spinal nerve typically, and it presents as a rash, a very painful, awful rash. That's the rash of shingles. So the shingles virus is actually the chickenpox virus version 2.0. It's the chickenpox virus coming back 50, 60 years later to affect you in a unilateral dermatomal distribution of a painful rash. But the point is, it's a neurotropic virus. It stays in your system forever, and it produces inflammation. And so now we're starting to connect the dots here that these viruses that stay in the nervous system can produce inflammation, which can then lead to neurological injury, subacute sclerosing panencephalitis, long COVID, HIV, dementia, multiple other examples of this. So it really looks like varicella zoster and herpes zoster very well they clearly are associated with dementia, and vaccinating against them clearly is associated with a reduced risk. Whether or not that's causative or associative, we cannot say yet, but it's still very, very interesting because the burden of dementia in the United States is huge and increasing, and is going to bankrupt the country trying to take care of tens of millions of senior citizens with dementia. It already is. Certain states are really being bombarded because they have elderly populations, Florida, Hawaii, for example. Now, consider this. Here we have exciting news about a chronic disease, dementia. And what is the word from the anti-vax community that now controls our public health system? And that is, they don't like this vaccine. They don't like any vaccines. And they say things like, well, shingles is just a rash. It's no big deal. No, it's not just a rash. The rash, people have committed suicide over this rash. I remember the days before we had any treatment at all for shingles, and the pain is so bad and permanent for so many people that people actually committed suicide over it. So it's not just a rash. And so there's a lot of sentiment, the McCullough Foundation, Children's Health Defense, Dr. McCullough, all the anti-vaxxers are out there urging people not to get vaccinated against shingles. Well, here we have pretty good evidence that it is associated with a reduced risk of dementia. But it also goes all the way back to childhood with varicella zoster. If you get vaccinated in childhood against varicella zoster, you got a 90% protection from getting chickenpox. That means the virus doesn't get into your nervous system in the first place. So it's not going to sit there for 50 years waiting to give you zoster later on. I had chickenpox as a child, and I have had the shingles vaccine. I don't want to get shingles. It's interesting that in the paper that was in Nature, they talked about how this vaccine may be particularly effective in vascular dementia, which is a different form of dementia. And that's very intriguing. So the mechanism of action may well be that these neurotropic viruses get into the brain, they produce inflammation, you get an inflammatory response with antibodies and other cellular debris and so forth kind of builds up in the brain. And that could be the basis for that stuff, that gunk that accumulates in the brain in these dementia patients. So this is very exciting. It would be really nice if an immunization could reduce the incidence of dementia by 20, 30, 40, 50%. That would be a miracle, and it would be a wonderful thing. And it is a again, unfortunate that people who don't understand biology, are not physicians, not infectious disease doctors, don't have the kind of training and experience in this field, are now running things and are discouraging immunization. The anti-vaxxers, it was dawning on me this morning, have complete control now of the government. They're at every level, from CDC to FDA with Bhattacharya to CMS to NIH, FDA, and Health and Human Services. They are in complete control. And what you will continue to see, I fear, is a continued effort to undermine and reduce and make and eliminate vaccination across the board. That appears to be the direction they are going. Interestingly, it was just mentioned in the news the other day that Kennedy is going to be collecting data on everybody with autism in the United States, everyone with that diagnosis. So what are they going to do? What he's going to do is correlate that with when they were vaccinated and say there's an association, temporal association. And as I keep saying, association is not causation. But mark my words, in a few months, Health and Human Services and Robert Kennedy will release a study that he says claims proves the association between autism and vaccination. He doesn't even understand what autism spectrum disorder is. Many patients with autism spectrum disorder are highly productive, brilliant billionaires. I think Elon Musk is on the spectrum personally. So anyhow, they don't understand. They don't know what they're talking about. They don't know what they're doing, and they are basically harming public health. Here's an opportunity where we should be investing right now in better studies to confirm this association between the shingles vaccine and dementia. If we can confirm this, we've got a tool here that we need to get everybody over 65 vaccinated against shingles. Will reduce the likelihood of dementia going forward. That would be a wonderful public health service and a great thing to do for our country and for other countries around the world. And unfortunately, what's standing in our way is the people that are now in charge, running our public health system and in charge of vaccination, and they will not be supportive of this. So I hope to see more studies if they're allowed to be done. That would be great. But I think you should keep an eye out, because I think we are now developing a better understanding of what causes dementia. Neurotropic viruses like varicella zoster may very well be the cause, and we may very well have a tool to reduce the risk of dementia. That's exciting, and I hope that anti-vaxxers don't obstruct it.
But that leads to another question: is what about the ongoing research on dementia? Because what we're looking at is that as the U.S. population gets older, 10,000 people turning age 65 every day, and then sooner or later it's going to be 10,000 people turn age 85 every day, that the incidence of dementia keeps increasing, and long-term care is not covered by Medicare. A lot of people don't know that. They go, well, I'll just go into a medical facility. No, you won't. No. Unless you have buckets of money or you have long-term care insurance, you're tough out of luck. So what sort of research do you see that's going on? To me, this was a great one, because it's like
there's tons of research being done on dementia and various treatments for dementia and preventative strategies and so forth at major academic medical centers. Beth Israel Deaconess Hospital in Boston is one of the leading centers for studying the use of monoclonal antibodies in the treatment of Alzheimer's disease. And all of these academic medical centers, teaching hospitals, Harvard and so forth, places like that, they're all getting bashed with cuts to their research budgets by up to 80%. Most major medical schools now are stopping research and laying people off. So, they talk about wanting to make America healthy again. Well, what they're doing is reducing the research budgets for most every major academic medical center and medical school in the country. They're all reeling. I just was reading the other day that University of Massachusetts is laying off 200 people. Johns Hopkins is laying people. They're all laying people off. I can only imagine the impact that these budget cuts, these DOGE budget cuts, are having on these academic medical centers. That's where the research is done on these diseases, and it's being cut. So we're in a downward spiral here. We're in a mortal coil and we're rapidly rejoining the Dark Ages and the Middle Ages.
Yeah. Before I came on board, I was reading a study about life expectancy in the top 10 cities in the world. And it was very interesting to see, like Seoul, South Korea was up there. Also Madrid, Spain, age 85. You know how many US cities made the top 10? None.
Yeah, I didn't
In
think
other
so.
words, in terms of life expectancy, and what I'm talking about, the whole world. So, are we having a serious health related issues in the United States where people aren't going to live longer and their health is basically going to be compromised on a going forward basis?
You make an important point, Nick. I've in my career in medicine is now 44 years. I have had the opportunity to work in many different settings in very sophisticated university academic medical centers like the University of Pennsylvania and OHSU, and in inner city hospitals in the barrio in Los Angeles, deep in the barrio, hospitals like East Los Angeles Doctors Hospital, and these are not the best neighborhoods. These are, and also even in critical access hospitals in rural parts. So I've seen it all. I've worked in VA hospitals. I've worked in a lot of different settings, and we have it's a tale of two centuries here, a tale of two nations. If you go into a place like Cedars-Sinai or OHSU, you'll see well-insured, affluent people getting really high quality care and living longer and doing well and getting treatment. If you go into places like East Los Angeles Doctors Hospital or Huntington Park Hospital in East Los Angeles, you'll see a whole different thing. You see patients who don't have, because they're poor and they don't have insurance. They don't have, if they do have Medicaid or Medi-Cal, there's nobody who takes it. And you'll see people who have no access to care. They've never gotten medical care. Their diseases are completely out of control. And it's stuff like you just don't see it. So we have two worlds here. We have a world of people who are like living in the third world medically, and diseases so far advanced, you'd never see that in a well-off, affluent hospital. So you average those two together, brings down the life expectancy. But it is so sad. We have such a two-tiered system here. We have lousy care and no care for so many people and on the wrong side of the demographic. And then we have excellent care for these other people who just happen to have money and good insurance. It's disgusting. And it's something that angers physicians. We should not have this kind of two-tiered system where some people who just happen to be people of color often are getting the short end of the stick medically and suffering because of it. And other people who just happen to be white, and working in corporate America, get the best of everything. You talk about institutional racism. Well, there it is. It's right in front of you. All you got to do is open your eyes. It's right there.
Mm-hmm. Yeah. In Spain, though, we have universal coverage, so everybody's covered. In
Right.
Spain, they do not have that, and frankly, it's the most of the European Union. People all have universal coverage, so it's not an issue. When I go to the United States, if you're on Medicare, basically have universal coverage, but anybody off Medicare, you're heavily reliant on a private healthcare system. When I was running my company, a sad thing every year was a fight to be able to keep the health insurance premiums from spiraling out of control with all the employees. And in other words, you really had a very serious problem, yet they were much younger than people on Medicare. Probably a topic of another day, but and the topic would be healthcare costs in the U.S. I mean, we just, a lot of people aren't afford it. Now let's talk about the shingles vaccine. Is this affordable? Can people afford to get the shingles vaccine?
I don't know what the cost of it is, but it can't be that much. I mean, if someone said to you, here's a vaccine that'll reduce your chances of getting dementia by 50% or 45%, and it'll cost you $100, who wouldn't take that? 1 month in a nursing home. My mom just passed away, as you might know, a month ago. Mm-hmm. And before she passed away, I was looking at, assisted living for her, $25,000, $30,000 a month. And she
Yep.
had long-term care insurance, but it didn't cover even $5,000 a month. So, I mean, do you have $25,000 a month to spend for assisted living? Most people don't. So, the idea that you could reduce the incidence of Alzheimer's disease and dementia by 45% is very exciting. That's a heck of an investment. And I don't care if that vaccine is $200-$300; it's well worth it.
Right.
Speaking of things that are worth it and all along those lines, Dr. Patmos, I was curious because I heard that our favorite person is saying that, and I know this is getting away from shingles and the elderly citizens and everything, but he's saying that kids don't need to take the COVID vaccine. I think that came out yesterday or the day before. Right. I just wanted your take on that because, yeah, our favorite person, RFK Jr., is making this notice that people do not need to take the COVID vaccine, particularly if they are young children.
Yeah, see, I disagree with that. I think it's based on ignorance. That comes from Jay Bhattacharya, who said that, Robert Malone, Peter McCullough, Robert Kennedy, and many other anti-vax doctors who I don't think understand. Their thinking is that, well, COVID basically just killed the old people, and the young ones didn't really get sick from it, so why vaccinate them? That's false. Yes, COVID did kill mostly older people, but not exclusively. About 20% of people who died of COVID were young, not elderly. So, it's only 20%. Over 1,000 children in the United States died of COVID, over 1,000. Now, granted, most of them did okay, but death from COVID isn't the only reason to vaccinate children. Long COVID, and then this other thing called multi-system inflammatory disease associated with COVID. COVID impacts children chronically, and it is a neurotropic virus. So I disagree. And I think the data shows that children should be vaccinated, and I disagree with them. I think they are not looking at the data correctly. They're saying that, well, since it's mostly the elderly who die, why bother vaccinating children? The risk of myocarditis outweighs the benefit. No, it doesn't. Look at the numbers carefully. I think they're wrong, and I think they're leading the country astray. And I am fearful of what will happen to children down the road who are not immune. Of course, the other thing is if you let the kids get COVID, they go home. Who's at home? Mom, grandma, grandpa. What are you going to do? Tell the children you can't, you have to isolate. You have to isolate the child because they have family members who are vulnerable. They're a reservoir. Even if the child isn't dying of COVID or sick with COVID, even if they're asymptomatic, they're a host reservoir. They're making the virus, spreading it to other people, causing the virus to continue to exist. We don't want to have a host reservoir. And by not vaccinating people, we're creating a host reservoir. This is basic biology that these so-called experts seem to not understand basic biology.
Dr. Patmos, would the American Medical Association have any problem with me giving medical advice?
Well, the American Medical Association is it's a lobbying group, a political group for physicians, a lobby for physician benefit. Yeah, they don't like it when people who are not qualified are giving medical advice. They fought, for years against chiropractors, and they opposed nurse practitioners and so forth. So the American Medical Association, advocates, lobbies on behalf of physicians to preserve physician, autonomy and so forth, and stop scope creep for other professions. But it's really the medical boards that should be disciplining people. Yes, it's crazy because if you give advice to a patient, a single patient, medical advice, if you're not licensed, you're practicing medicine without a license. But yet, if you go on TV, you can give Robert Kennedy is giving advice on health and medicine. He's not a doctor. He's not licensed. It's insulting to me as a physician that a non-physician is telling the country how to manage measles and other things. Who is he? He doesn't have the legal authority to advise patients, doesn't have the information and the medical background, the education. It's awful. We are basically allowing unqualified people who haven't even done internships, who don't have medical licenses, who never completed residencies, who've never seen a patient at the bedside, are now dictating medical care in the United States, where licensed physicians with credentials and experience are just being pushed aside.
And that's what I was getting at. In other words, it should not be RFK making a blanket statement, your kids should not be vaccinated. I want a medical doctor to stand up and say that, not RFK.
And I don't want
Why
RFK
would
saying
a medical
that.
doctor be willing to say that? In the meantime, we have this gentleman who's, in my opinion, maybe practicing medicine without a license, because that's what he's doing right now, Dr. Pappas.
He's giving advice. He's telling people, vitamin A. He's advising the country on how to deal with illnesses. He's not qualified. If Robert F. Kennedy can give advice on medicine, then I want to be a constitutional lawyer without going to law school.
Yeah, and that's the problem. I'm looking at, since the government, which are these people right over here, are obviously inept, or they would have removed this guy a long time ago. Where could you go to get advice on medicine? Specifically, I look at the Mayo Clinic, I look at John Hopkins, I look at the Cleveland Clinic and Harvard. Would that be the best place for people to go to? Because this place should not be a group that you're getting medical advice from. What are your thoughts on that?
So for physicians and healthcare providers, nurse practitioners and physician assistants and so forth, UpToDate.com is your best tool, because UpToDate goes through all the medical literature, filters it, sorts it, throws out the junk, keeps the good stuff, and it gives you a nice, discrete, succinct topic summary on every time, and it's updated in real time. So you always have the latest and the best, current best evidence. UpToDate is the tool for doctors and healthcare providers. For the lay public, you can subscribe to UpToDate. It's a little pricey and it's a little technical, but no reason why anybody can get a subscription to UpToDate. So a lay person can certainly get access to current best evidence through UpToDate. That tool is so important that if a doctor is not using UpToDate, they are not up to date. I've hired and recruited hundreds of physicians over the years. I will not hire a doctor who does not use UpToDate. They can't be up to date unless you're using this tool. Now, for consumers who don't want to, patients who don't want to, go with UpToDate, online, go to your major academic medical centers. Mayo Clinic has got a great website. Massachusetts General, all of the big academic medical centers have websites that are geared toward the lay public, and they provide all kinds of information. Mayo Clinic is excellent. They really have a great source. Where not to go, do not go to social media. Twitter, X, Facebook. This is no place to get medical information. Any physician who's getting medical information off social media needs to be disciplined by the medical board. And for the lay public, you cannot trust anything on social media. Go to reputable academic medical centers and look at their pages that are directed toward the lay public for information. And then also ask your doctor, but make sure your doctor is using UpToDate.
Yeah, well, also we do broadcast on almost all social media networks. The latest we're broadcasting on TikTok, which TikTok is kind of amazing. They'll get like 10,000 people at every one of our events. It's just, I don't know how they do it, but they tend to bring it. But in the meantime, we do want to thank Dr. Patmos and this great conversation relating to dementia and shingles. And it's something you definitely need to look into, but please don't go here to look for medical advice, and don't look for an attorney and doctors pretending to know what they're talking about and here. Instead, go to the major sources that he recommended, and we'll see you next week on Medicine and Science on the Pod TV network. Until then, take care. Bye-bye.